Okay, so now we are on the last part of our ICD-10 CM Expert 2026, and we are in section 1. We on the letter C, chapter specific guidelines, and we're starting off with chapter 12. So right here in your book, we're at chapter 12. If you followed the videos for the first section in chapter 11, in the first part, then you know that we went through chapters 1 through 11. So if you haven't gotten to that video yet, just go ahead and look at that video, or you can start with this one. Either one is fine, but both of them will be up. So we're starting with chapter 12. Remember, red pen and whatever kind of highlighters you want. Okay, I have all of these, so I can choose from either one. All right, and I am Miss K with Inspired Code Consulting. So let's finish off. So last we did orange and yellow, and this was our chapters. Every time you see this color, it's our chapters. This is chapter 11, chapter 12. And then we use two colors for the letters and for the numbers. So now I'm going to choose two different colors so that we can actually see how it looks. So we'll just go ahead and do with the yellow and blue. Remember, you can choose any color that you want. However, I'm going to make sure that you are highlighting what you need to highlight and make sure you are writing in here what you need to write. So let's go ahead and start with chapter 12. And like I said, if you wanted to take and put a star by each one of your chapters or an asterisk, anything like that, that is fine. You can do so. But right here by chapter 12, let's go ahead and write ulcers. Okay, so we know we are dealing with ulcers. All right, and what we're going to do is make sure we highlight that. All right, so for this section here in A, let's get started. So we're going to highlight A. And remember, in the last video, we'll do the same thing. We done our letters A and then B on this page. And now we're going to go in and make things stand out a little bit. So under A1, let's go ahead and highlight 1. All right. And then under here, it's going to say L89 pressure ulcer. Let's go ahead and highlight that. And then also stages 1 through 4. Deep tissue injury, unspecified. Let's go ahead and highlight that. Okay. And then when we do that, right by this graph here, this graph here is going to tell us everything we need to know about the ulcers, right? However, we're going to write some notes right here. So what we're going to write is some things, how we need to put them in sequential order. So right here, we're going to put something. Right here, we're going to put something. So I'm going to put this down. First thing, pressure ulcers and BMI. Let's go ahead and write that. Pressure ulcer and BMI. Okay. And the way you code this is the first code should be a L89 code. And the second code should be Z68. And remember, we're always going to put this dash because this is going to be per the documentation. But if you need to know how to code this in sequential order, this is how you would code it in sequential order. And then also, let's put gangrene. And then the first code would be I-96. The second code will be L-89 to L-97. Okay? So we're going to write that. Now, let's take and highlight, and we're just going to take and remember, everything we put in right, that's the way that it needs to be. That's the order that it needs to be coded. That's what we're doing. We're making sure it's coded in that particular order, so there's no confusion. No confusion at all. All right, so for number 2, for unstageable pressure ulcers, let's go ahead and highlight that. And then it's going to be L89 ulcer, L89-0. And it says this code right here. It says this code should not be confused with the codes for unspecified stage. That's what I want you to highlight. This code should not be confused with the codes for unspecified stage. All right. Then number 3, 4, 5, 6, 7. Now, if you're one of those persons, you need to make sure that everything is like another, we can put in another color here. Let's go with, say, a purple here. And I'm just giving you options so that you can see how different it can be. Just giving you some options. So under number 3, we want to write right under number 3, the stage and the provider. Well, that's not two different. Well, it is two different colors, but you know, hey, L89.9. Just write that L89.9 right there, because you're going to be in that particular area. But remember, you can't query on the exam, but in real life, air quotes, real life, you can definitely query. Under number 4, we want to go ahead and highlight no code. Okay. I think I'm going to choose another color, you guys, so that you can at least see a difference, because I'm not sure if you're seeing a difference like that. Under number 5, stage of healing pressure, right under in the last line. There we go. There you go. All right. Under number 5, and then unspecified stage, and then also unclear, and then also query the provider. All right. So under number 5, we did stage of the healing pressure ulcer. We highlighted unspecified stage. We highlighted unclear, and we highlight query the provider. Under number 6, we are going to highlight one stage. Start right here with one stage and just highlight the rest of the paragraph starting at one stage. Okay. All right. And what we're going to do is we're also going to write something right there as well. So the first will be stage of stage of POA, point of admissions. Second would be evolved stage. Remember, you guys, I don't have a good handwriting, especially when it comes down to printing. I hate printing, but I have to show you guys. So make it clear for yourself. First, stage of POA, point of admission. Second, evolved stage. That goes by number 6. And when you get to number 7, the only thing we want to highlight in number 7 is L89 to 6. B for in pressure. So we do this here. Where's the blue? Okay. So number 1, 2. Okay. And then under B, B1, we're going to highlight no code. And under B2, let's write L97.9. Okay, so we got that. Number 3. Okay, number 3 is going to be on the next page. However, I just want to make sure you guys have this here. So on number 3, we have this information. Now on number 3, we're going to write something by number 3 so that we are aware of number 3. Okay. I'm on page G20 at the top of 3. And we're going to highlight 3. Okay. And we're going to write something right here as well. So we're going to put stage. One is going to be stage of level. And then 2 is going to be evolved level of stage. So 1, stage of level. And we're going to put, I think POA. Hold up. Yeah. POA. And then number 2, we're going to write evolved level of stage. Evolved level of stage. And this is going to be, put this word leave. So this means when they first come in, what stage is it at when they first come in on point of admission? And then when they leave, where has it evolved? So when they come in, it could be stage 2, but when they leave, it could be stage 3. So you make sure you code it in that particular order. All right, and let's go ahead on and highlight that and make that stand out. All right, now we're in chapter 13. Chapter 13, we're going to do sight and laterality. And so this here is going to be a little bit different because I want you guys to know in this area here, and let's go ahead and highlight our alphabets first. A, B, C, D, and E. All right. Now, this is going to be the thing. In this particular area, just so you know, throughout this book, what you're going to find some codes, not all codes, but some codes, it's going to end in the number 1. And for laterality, 1 is right, 2 is left, And 3 is bilateral. So we're going to go ahead and write that right there. Okay. Go ahead and highlight that. And then we're going to go ahead underneath there, bone versus joints, and then that. We're going to go ahead and highlight number 1 here, and then number 2 there. All right. And then we're going to take this here marker out, orange marker. All right. And we're going to go M87 for osteoporosis. Okay. M80, those. I'm sorry. All of that. There you go. That whole line. And number 2, for multiple sites, we're going to highlight this entire paragraph. Okay. Under B, that second line, it says to a site. To a site. You see that? I want you to highlight all the way until you get to chapter 13, which is right here. I'm sorry. Wait, let me make sure. Yeah, that was right. The last chapter 13 right here. All of that. Okay. And then after you highlight all of that, we're going to come to C. And in C, we want to do the 7th character all the way till we get to at the end of this line for the fracture. I guess these 2 colors aren't that different either, huh? That's okay. And then come down here to this second paragraph right here. And we also want to make sure we highlight this. And we're going to stop at this word phase. So let's do this. Right there. Start with 7th and end at the word phase. Okay. And then we're going to make sure that we highlight this. That's the guidelines for traumatic fractures. And it's telling you need to go to chapter 19. See where they have this 19 at? We're in section 1. We're under C in chapter 19. Remember, in the first video when we was doing A and B, I showed you how to read your guidelines. So whenever you see this, you know how to read your guidelines. So please refer back to there. And then also, just to kind of give you an idea, right here next to C, I want you guys to write this here. GKPS. And these are subsequent encounters of fracture with healing. Let me make sure my book is right. Okay. Subsequent encounters of fractures with healing. Make sure you write that. Okay. And then D for osteoporosis. Category, we want to make sure we know that osteoporosis is in category M81. Under osteoporosis for pathological You want to make sure this category is M81. And then M80 is without current pathological. Number 2 is here. Now, for this section here, we need to write a note. We're going to have a couple notes on this page. So we need to really all right. So right here, we want to write, and let's see how we can write this so that it'll make sense, so that you guys know. So I'm going to write it, let's go this way here, so that it can be read. So I'm going to write this here. It says, never, and my arm is really crazy. It feels funny. Never code an acute fracture, FX is fracture, and pathological fracture, FX. You could write the word fracture out if you want to. In the same setting, for sight. Never code an acute fracture and pathological fracture in the same setting for sight. You should be putting that right here by D. Okay. We have a couple things we are going to be writing. Now we're going to 14, E. And then right here, we want to write personal history of osteoporosis. Personal history, HX is history of osteoporosis. And the code is going to be Z87.310. Go ahead and write that right there. All right. Now we're going into 14. We are going into 14. And this here, of course, just like all the other graphs that we have, follow that first question. Is the patient receiving active treatment for the fracture? Yes, you go to that. No, you come down here. Okay, same thing. Okay, so now we're in chapter 14. So chapter 14, the way we code chronic kidney disease, first, we're going to go ahead and highlight A. And then we're going to do let's go 1, 2, 3. And now what we want to do is, this is imperative. We are going to highlight this whole entire paragraph. So let's go ahead on and do it. Okay, including this. All right. And what we want to put here is the way you code this area is going to be first code is going to be N18 point and whatever the stage is. And then the second code, Z99.2 for dialysis. And we're going to put if applicable. And then we're going to take and highlight that. Okay. And we're going to make some other things stand out here as well. So under number 2, we're going to highlight kidney transplant. And then we're also going to highlight code Z94.0 right there under number 2. Under number 3, and let's make sure you know that Z99.2, that's going to be for your dialysis, okay? So if they are on dialysis, that's your dialysis code, that Z99.2. So that's why we put it there. For number 3, we're going to make sure we highlight this guideline and everything we need right here. Okay. And we can also write kidney transplant, which it'll just kind of draw you back up here. All right. If you want to write kidney transplant right here, you can. I can't write because the way it is. But just write it there. Okay. So chapter 15. And listen, once you write your note, go ahead and highlight it so that it can stand out. I didn't do that on a couple of them, but let's go ahead and do it anyway. And then under chapter 15, okay, chapter 15, now we're in the obstetrics. So we have a lot of information that we need to write in here, okay? So I want to be sure that we are capturing what we need to capture. All right. So first and foremost, what we're doing, A, B, C, D, E. And then we're going to go with our numbers. 1, 2, 3, 4, 5, 6, 7. Under B, 1, 2, 3, 4, 5. In E, we have 1. Okay. And now, you know what? I'm actually going to use this purple because I want to make sure it's standing out for you guys. Now, remember, you guys, I'm using different colors. It doesn't matter for me because I'm not testing, but I'm just showing you how it can be different using a different color so that you know. And I just want you to be mindful of that or whatever. So remember, when we get to a chapter, you can put a star or you can do an asterisk, whichever one you choose. Just put it by each of your chapters from 1 all the way to 22. Okay. Now for this area here, under number 1, we want to highlight that first sentence. And I'm going to use purple just so you can see the difference. Remember, you want to use markers that don't bleed. And I know y'all see how mine is. And then right here where it says, should the provider document, we want to highlight that sentence. Okay, you can stop right there. And then under number 2, we're just going to highlight that whole thing. Number 3, we're going to go right here to this second paragraph in the first 2 lines. Okay, there we go. Now, we have to write something right here. So, this is how we're going to code this particular area. So, we're going to try to make it stand out. All right. So, we're going to go with routine pregnancy without complication. W/O complication. And your primary diagnosis is going to be Z34. Your secondary diagnosis is going to be the weeks of gestation. And then you have the code you have your weeks of gestation. That was correct. Okay. Now, for your pregnancy incidental to the encounter, just kind of skip a line and put pregnancy incidental to encounter first code is going to be the non-related illness, pregnancy illness, non-pregnancy illness, related illness, related illness. And then your second code is going to be the Z33.1. And it says, do not use code from chapter 15. Okay. So we can go ahead and put a line right there. And you can highlight that. Now right here, I want you to put trimester weeks. Page, we got to find out what page is on. Trimester weeks. It's going to be, let's go. Let me find out so you can put the page number here. So we're going to go to the O codes. And I'm going to tell you so that we can put the right thing there. And show you where it is. Okay. And our trimester weeks are right here. We're going to go ahead and highlight them. And it's going to be on page 948. So trimesters, let's go ahead and highlight that in here. We're on page 948. And we're going to highlight first, second, and third trimester. right there. Then we're going to go back to our guidelines. And we're going to put page 948. And this is going to be our O section. And then right here, we're going to put the weeks. You're right there. Z3A page. Now we got to go find. Let's go and find Z3A and see what page it's on. So that way we don't have to be scrambling in this particular book. And it's going to start on 1355. Z3A, page 1355. So let's go ahead and put that number in our books. Page 1355. There you go. And let's go ahead and highlight that. Okay. Okay, we're going under number 4. And number 4 right here where it says, it says assigned on the basis. Right here, assigned on the basis. Wait, we had purple right there. We want to all the way till we get to discharge on the next line. Okay, yeah, I kind of went off, but that's okay. All right. And then 5, right here, we just want to do those bullets right there because that's the 7 characters for the fetus, however many fetuses they have. And this is your bullets. Number 7, you should be fine. And B1, you want to put no O code. Okay. And then under number 2, chapter 15. Under number 3, that first sentence in the episode, and you want to go all the way until you get to correspond. And right here, you want to write first RFE, reason for the encounter. And then second, you want to go ahead and highlight this. Just put an arrow, just like that. And number 4, when a delivery occurs, we're going to highlight that first sentence, starting with an obstetric. And we're going to end right here on diagnosis. So this is going to be our beginning, and this is going to be our end. Okay. That's why I say don't use markers that bleed, because look at that. All right. Now Now we have some things we need to write right here for this section here. So, and listen, find it however you see fit in your book. Just know where it needs to go. Okay. So first, you want the condition that prompted admission. Condition that prompted admission. Second, you want all other O codes. Third, outcome of delivery. And fourth, weeks of gestation. Lord, if I can get somebody else to write this would be so wonderful. Remember, pause the video, rewind it, so that you can have, and listen. In number 5, where it says outcome of delivery, the outcome of delivery, you just want to put the second, it will be the outcome of delivery. And it just tells you right there, that code right here. That's what you want. Now, C, when you start getting into your pre-existings, these conditions right here, for this one here, I'm going to put it on this side here so we don't fall into this here. So right here for C, your first code should be O10 and your second code should be the hypertension code from section 9. From section 9. Okay. And put this right here. So that you know. Put that arrow right here. I put it too high up. I should have came down some right here. All right, and then under number 1, for codes from category, we're gonna highlight everything up until problem right here. All right, and we completed page G21. Okay. 2. Let me make sure what color we did the numbers. Blue. But the letters we did in this color here. F, G, H, I, J, Okay. So for number 2, we just know we're going to highlight this category is in that section 035. In F, we want to highlight 098.7. And then we also want to write B20 right here. Okay. And then this here, patient with, and we're going to highlight that. You can stop at the Z21. G, okay. G, the only thing we're going to highlight is right there. H, we're clear. I. So I for gestational pregnancy-induced diabetes. We're going to write something on the side here. The first is going to be 024.4. And the second code is going to be Z3A. And remember, we're putting the dash so we can go and complete the code per the documentation. Okay. All right. We're going to write something here. 0 weeks, Z13.4. You want to write that. And then down below, right here, we want to code right here, code 0 weeks. Uh-oh, the book is messing up right there. Pull it over so you guys can see. And then I'm going to put right here, so it says, if a patient, in this third paragraph, third paragraph under I, if a patient, right there, highlight that. And we're going to come all the way until we get to insulin controlled required. So everything in between there. And right here, I want you to write, don't code insulin. Right there, don't code insulin. For J, and we're going to write J on the next page so that we can make sure. We're going to go ahead and do this here for chapter 15. And we're going to write O code, because that's what the codes are in chapter 15, O code. And then we're going to turn the book over. And by J, first is going to be, the first code is going to be an O code. Is O code. The second is specific type of infection. Specific type of infection. Third is going to be the R65.2. And then fourth is going to be the organ dysfunction. If applicable, and put that if applicable in parentheses. Go ahead on and do that. Okay. And we're going to go right here and say organ dysfunction right there. And we're going to write something on that graph. I want to kind of draw something out on that graph for you guys too. Let's kind of go back to it. Right here. So here, 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 anywhere you can write this here. And it says how to code deliveries. And you can put it anywhere on here that you want. I just want you to have it so that you know. So I'm going to put it right here. How to code deliveries. Number 1 is going to be the type of delivery. Number 2 is going to be outcome of delivery. And number 3 is going to be weeks of gestation. And then go ahead and highlight that. So I want to make sure you have that. And then on here, because this graph is kind of so detailed, we want to be sure. So we're going to do diabetes, and we're going to do pre-existing. And then this side here is going to be pregnancy induced. Let's do that. All right. And this here is just going to there. And then this here there. Okay. And we're going to make sure we have this here. You want to make sure y'all see that really good. Okay. Okay. All right, now we can actually move on, because I wanted to make sure I do something on that table for you guys. Okay. So now that we're about alcohol, let's go ahead and finish our, we did, the letters was what? H is yellow. Okay. I'm trying to stay with the same. So this is K, L, M, N, O, P, Q, R. All right. And then our numbers is going to be 1, 2, 3, 1, 2, 3, 1, 2, 3, 4, 5, 1, 2, 3, 1, 2, 3, 4, and we're going to do 5 right here. Okay. Now, let's go ahead and we're going to highlight some stuff in here. So, under L, number 1, let's highlight 09931 right there, as well as category F10. And we're just kind of making things stand out. Under number 2 will be the 09933 category and category F10. And basically is just telling you guys to use this category for it. And then a secondary code we're going to use from F17. Because I think I said F10. Number 3, same thing. Number 3, we're going to do the same thing, 09932. All right. And it's telling you to use these particular codes here along with it as secondary diagnoses. Under M, it's going to be 09982. And this is going to be toxic effect. Look for toxic effect. And then after toxic effect, it says then additional code, which is that second line underneath it. That line right there. N, we're going to do code 080. And we want to write next to N, normal. Okay. And then the way you code this, the first code should be 080. And then the second code should be that Z37.0. And then the third code is going to be the weeks of gestation. Okay, and we put that right in there by N. Okay. So 2, we got uncomplicated. We don't have anything. Number 3, outcome. We're going to go ahead and do Z37. Now, under there, we want to put age second, 35 and older. So this is an important, let's see where we can put this at. I'll put it at the bottom of this page. And it's going to be before O. So let's put it like right here. Let's just go ahead and put it on the side because it's a lot. Age second. Let's go age second. And we want to put 35 and older. Pregnancy. .521. And just put that arrow up there because this goes with this section. Right here in this section right there. Okay. All right, in the O area, number 1, we are going to highlight that entire paragraph under number 1. Number 2, highlight that sentence. And number 3, chapter 15 codes. Number 4, code Z3980. And number 5, 090.3. Highlight that. Now for P, we in this section right here, we're going to write some things. So first is, it says the code describing the complication. And then second, you're doing the 094. So that goes with number 1. Y'all, I'm telling y'all, I used to be great at this. Then I let somebody else start doing this here, and I done got out of whack. But put it in there how you see fit so that you know. And then for number 3 right here, we're going to do kind of the same thing. It says first code, number 1 is going to be code description. The sequela. The sequela complication. And then number 2, 094. Okay. And if you're prepping your book and you haven't really gotten into it, don't worry. It'll make sense when you start coding. It'll make sense because it's going to bring you right where you need to be. All right, so Q, we just need to do the Z33.2. Number 2, we need the 003.4 and the 0007.4. And then right here where it says if the patient has, and just code the rest of that paragraph. Number 3, highlight that. And then we're going to write second, any other appropriate O codes. And number 4, do not assign right there. We're going to highlight this first line. And then we're also going to highlight this. And then we got this. And notice I'm highlighting these codes in these sections so that it kind of shows you where you need to be at. It could be this, this, or this, depending on the documentation. So that's why we're doing that. And then for COVID, 098.5. And then it says code the U071. And then right here where it says appropriate codes, right there. And reason, now this one here, you want to, of course, has been diagnosed. Right here where it says reason for the admission encounter, and it says should be sequenced. You can highlight the rest of that. Y'all, these new markers, I hate the fact that they're bleeding through. Okay. We're going to page G24 because we just got a couple more chapters left. We're in chapter 16. And we're gonna highlight and write some stuff. Okay. So let's go ahead on with our letters. A, B, C, D, E, F, G, H. And then we're going to go with the numbers. 2, 3, 4, 5, 6, 1, 2, 3, 1, 2, and that's it. So our chapter is one color, our letter is one color, and our numbers is another color. Now what we need to pay attention to, and I'm gonna go back to using another color so it can be a little bit more visible, because I'm really not liking that. Okay. So right here by A, you can go ahead and write newborn birth by number 1. Newborn birth. Okay. Now, let's highlight some stuff underneath there. And the first thing we're going to highlight is that first line. Right under number 1, first line. And then the last line under number 1, highlight that. Number 2, highlight the first 2 lines. Or stop at Z38. Number 2, highlight and stop at Z38. Number 3, highlight if the reason for the encounter and keep going until you get to the end. Number 4, should continue. And you can highlight the rest of that. I don't know why I stopped. Number 5, the default is due to. Codes from chapter 16. And number 6, we're just going to do that. And then we're going to go B1, assign codes from here. And then in such cases, That's what you want to do with that. Okay. We're making progress. We're making leeway. Number 2, as principal are first listed. Number 3, the whole entire paragraph. C, 2, the whole paragraph. D, it says, unless it is documented, highlight that. And then you're going to highlight the first 2 lines in this paragraph here. Right there, the first 2 lines. E, PO7, category PO7. And right here, we want to write age. We need to know the age. F, P36. G, P95 for stillbirth. And then the H for COVID, we want to make sure we highlight P35.8 and Z38. Now, we have a note to write here. All right, and this is our sepsis note. Okay. We got a couple things that we're going to write. Oh, I hate that this stuff, we don't have enough room on these pages. Okay, so let's try to minimize this here. So we're going to do, we got 1, 2, 3, 4, 5 sections to write. No, 4 sections. 1, 2, 3, 4. 4 sections to write. So because I'm talking about sepsis, I'm going to kind of start up here, right here by sepsis. So the first code should be P36. The second code should be R65.2, and we're going to do that dash. And the 3 says, of course, organ dysfunction. If applicable, we have to keep putting that because everyone don't have, and put it in parentheses, everybody don't have organ dysfunction. Okay, now we're going to also write, this is if they have, this one will be B96. So B96 is the cause of, what is B96? Causal organisms. Okay, so this is if they have like a causal organism. So you would do 1 P36, 2 B96, 3 R65.2 in the dash, and no organ dysfunction. And it's horrible, y'all, because I'm trying to write it small so y'all can see. So if an infant has COVID, first it will be Z38, and second would be P35.8 and U07.1. Okay. Now, 17, right here, you're going to write first is going to be the Q, 00 to Q, 99, and number 2 is going to be the manifestation present. That's 17. And that's how we're writing. There we go. Please write them. And if you have a big handwriting, the bigger the better. Just make sure you circle it around where it needs to be at. All right, we're on chapter 18. Let's go ahead with our letters. All right. We don't have no numbers. Oh, yeah, we do have numbers. We got one number, yo, right there. We're almost done. All right, so 18. All right, under A, we're going to highlight all the way up to diagnosis. That first sentence from diagnosis all the way to the beginning. B, diagnosis, right here, such. It says diagnosis such as, right there. And then various signs and symptoms, right there under B. Diagnosis such as various signs and symptoms. That's what we want to highlight. When we get to D for repeated falls, that whole first line or whole sentence. And then we're going to highlight the history of falling. The comma in E, the comma scale codes. It's right there. Oh, and I'm sorry, I was right there, huh? Code R4020, R4020. And we're gonna do Glasgow comma scale under E. Number 1. And then under number 1, we're gonna come down here to 1, 2, 3, 4th paragraph by assigned code R4024. That whole first line. Like that. And then for SIRS, for G, okay, so for G, we're going to do underlying condition. Let me tell you where that is, right here. So 1, 2, 3, 4, 5. Underlying condition on a 5th line. Acute organ dysfunction right underneath it. You should see it. R65 is right by R6511. So yeah. Okay. And then we're going to write something right here. First is the underlying condition. 2 is R65.1 dash. And 3, the organ dysfunction. Okay. And under I, we're going to go ahead and highlight this right there, stroke. And now we're in chapter 19. Let's go A. B. All right. And we're going to go with our numbers. 1, 2, 3. And in chapter 19, so fractures, we want to highlight A for initial encounter, D for subsequent encounter, and S for sequela. That's what you want to highlight right there. Then we want to come down here to 7th character. And then this tells you the initial, subsequent, okay, and then sequela. The coding of injuries, and it says right here, under code, it says codes from category T07 unspecified, and I want you to complete that out until you get to more. So not assigned, just the second line, just go to the second line underneath it, highlight it. And then we're going to go by traumatic injury and complete that out. Superficial injury, we're just going to highlight that first line. Number 2, we're going to start at when and end it at primary injury. When, and this is the primary injury right here. And number 3, chapter 19 should not be assigned. Okay? We don't have nothing to write there. So let's go ahead and turn the page. Okay. And under number 3, I'm sorry, C. Wait, let me make sure we finished. Oh, that's what I forgot. Under number 3, iatrogenic injuries that last, assign the appropriate complication code. That's what I forgot to tell y'all to write. I knew I was missing something. Okay. And then Now we're under C. C, let's do this. C and D. Mm-hmm. 1, 2, 3, 1. All right. Under C, we want to, it says right here, by sight. By sight. And then you want to go all the way until you get to the level of detail right here. So highlight all of that, the level of detail. There you go. And then a fracture, this whole paragraph here. And we actually want to put a star right here because that's a little bit important right there. We need to know. Under number 1, initial encounters, and we have A, B, and C. And you want to come down to 1, 2, 3. Let me see, it's, wait, where am I? 1, 2, 3, 4, the 4th paragraph right here. And where it says the appropriate 7th character, we want to do all of this right there. 4th paragraph. And then we're going to go 5, 6. And then it's going to say the open fracture. And right here where it says 7th character for open fractures type 1, right here at the bottom of the page. That's what we want to highlight. Okay. Highlight under number 2, all of this. Number 3, type of fracture. And then right here, let's go ahead and put the word burns. We can go ahead and close that off. Okay. And this is what you want down here. First, the highest degree. Second, the second highest. And then the least highest. All right. Now we're gonna really write down some stuff here because we really need to know. Or maybe not, because they may not have. Oh no, I'm sorry, you guys. That was right here. They just made it smaller. Now, we are going to write this by this graph because this is the only area where we're going to have, first of all, we have burns here and we're going to put the rules right here. So we're going to go ahead and write these rules because we need these rules to be written, okay? Code rules for burns. code rules for burns. All right, number 1, location on the body. Number 2, severity of burn. And it should go in order: 3rd degree, 2nd degree, and 1st degree. 3rd should be the extent of body surface area. Let's put a backslash. Total body surface area and we're going to right here put TBSA because that's what you're going to probably see. Number 4, agent. That means you're going to get codes from X, W, Y code. Could be any one of those. 5th, sequencing rule. If multiple burns of different degrees sequence the highest degree first. Put a line right there. So now, the way you code that, it should look like first is T20 to T25. Degree should be 3rd to 1 according to the location of on body. And then number 2 should be T31 or T32, which is the extent. This is the TBSA. And number 3 is the agent. VWXY. So now you know how to code the burns in sequential order. And I also have a burn video on my YouTube page as well, on this same YouTube page. So you can go and look at that on sequencing those burns. So you can see how all of it goes. And we're just going to go ahead and highlight that like that. Okay. Remember, rewind, pause it. Okay, let's go to the next page. And let's go ahead on and do 2, 3, 4, 5, 6, 7, 8, 9. We're doing the numbers. So 1, 2, 3, 4, 5. And we're going to do the letters. Did I have a letter on here? I think I did. E. Okay. All right. So right here under B, we want to highlight first listed diagnosis, which would be the reason for the encounter. So you can put RFE, and if you need to, put reason for the encounter, RFE. So you know what that means, okay? And then C, we want to highlight all of it in C. And also do the RFE. Reason for the encounter. Number 2, we doing on site, on the same side, identifying the highest degree, recorded in diagnosis. And then this here, it should, and we're going to write one code only. One code only. So non-healing, we want to highlight this here under number 3. Under number 4, we want to write first T20 to T25. And then second, we want to do the type. Make sure you highlight that. Number 5. Right there, that first line up until T30 on the second line. Number 6, T31, T32. And you want to highlight the burn and the corrosion too, because T31 is for burn, T32 is for corrosion. Number 7 should be coded with the burn, and just highlight the rest of that. Number 8, current burn, right here. And it says with 7th character, A or D. All right. And then adverse effects. So right there, let's go ahead on and put a line through here. And we're going to write adverse effects. Let's just so we know what area we in and where it started. And in E, under E, that first 2 lines, highlight the first 2 lines underneath it. Or the first sentence, I should say. There you go. And then, let's try it over. number 2. And I want you to write this here on the side, which we're going to write it on this side here, over here by the number 2 in this area. And we're going to write when the degree, of burns is not specific code T30. All right. Under number 4, this whole entire paragraph. Number 5. Oh, we didn't do the correctly prescribed and properly administered under A for adverse effect. And then you also want to highlight T36 to T50 under A. And under B, poisoning, the whole entire paragraph, first paragraph. And then you have the second paragraph. And in the second paragraph, that last sentence, it says, use additional code for all manifestations of poisonings. And in examples, you want to highlight error, and under number 2, overdose. And you want to go with non-prescribed drug. And we're going to turn the page. And we're going to go with interaction of drug. Okay. And underdosing, let's go ahead and do our letters on this page here. We are almost done. Okay. And then our numbers is going to be a different color highlighter. Okay. All right, now let's highlight here. We just have a couple more pages left. All right, so for underdosing, we're going to go ahead and write how we should code this. The first should be primary diagnosis. DX is diagnosis. Second, it should be subsequent. Or T36 to T50. Third, so we have a couple things for the third. Three, we're going to put subsequent, and it's going to be a couple codes. And it's going to be in these particular sections so that you know where it's coming from. And that's why we're going to put or sub, and it's going to be Z91 1 2 and we're just going to write these codes. It could be any one of these: Z790, Z91 14. It's not going to be all of these codes, or Y69 and Y63. Wait, let me make sure that's Y. Yeah, Y69 and Y63. Now, this is the order, but it can be any one of these, not all of these. Okay, and that's by underdosing. Under toxic effects, the toxic effects codes are right here. F, start with T74. And we're going to go all the way to suspected. So we're going to do all of that right there. And right here it says, for cases confirmed, abuse, you have this here. And then you go Y07, should be added. Ruled out during an encounter. Ruled out during an encounter. This is under F in that paragraph. We're under F in that paragraph, and I'm going down, so you can always look for it. I'm just reading out what they have so that you can just search look for just that. Ruled out, or Z0472. Alleged rape or sexual abuse. Z0441, encounter for examination. And not a code, which is the last line from T76. And then in this last paragraph, sexual exploitation, highlight. Z0481, encounter. And then forced sexual exploitation, or code Z04.82. And then at the end, not a code from T76. That's what you should have highlighted in that paragraph. And complications of care, we're going to highlight that guideline. Okay. All right. On the next page. I'm sorry, next section, I should say, not next page. Okay. Number 2, right down here, codes found in chapter 19. Right there. And we got to go over T code section in G89. I'm sorry, I forgot to finish that one out. And then you got your G89 codes right there. We're under number 3A. Codes under T86. And a transplant complication code right there. B, we're going to code T86-1. And then we're going to highlight code T86-1. This entire paragraph should not be assigned for post-kidney. And we can stop at documented, which is right here. Code T86.1 should not be assigned for the post-kidney transplant patients who have chronic kidney disease unless a transplanted complication such as transplant failure or rejection is documented. That's what I want you to highlight. Number 5, post-procedural in the first line. And then body system chapters in the second line. And these codes should be sequenced first on the third line. Now we're in chapter 20. Okay. And we have a couple things we want to highlight here. So these codes should never be sequenced as the first listed diagnosis or principal diagnosis. Okay. And these are your injury and then your cause. And the place where the event occurred, time of event, and status. Those words right there. And then underneath here, right before you get to A, we're going to write V-W codes come before Y codes. That didn't come out too good, but I got it. And then for this area of codes, we're also going to write never code first. And then also, so these codes, they start with V00. So, excuse me. I'm going to look for those codes V00 so we can put the page on it so you'll know exactly where to come. Page 1262. Page 1262, and that's where we're going to put that at, okay? So let's go ahead and put V00 to Y99 is page 1262. And let's go ahead and highlight those. Perfect. Number one, this first line up until Z99. Okay. An external cause code may be used with any code in a range of and stop at Z99. And then also, since we're on this page, let's go ahead and do our letters. C, D, E, F, G, H, I, J. And we're going to do our numbers. Let's do our numbers with the purple. Ooh. Okay, and now we're going to highlight some other stuff and make plain. So we're under number 2. And under number 2, the most categories right here. So we want to highlight the first 2 lines. Let's highlight the first 2 lines. And then we're going to highlight A for initial, D for subsequent, and S for sequela in that 3rd line. Number 3, we're going to highlight cause, intent, and place of occurrence. Nothing for 4. In number 5, we're going to do alphabetical index of external cause is an injury, just that whole line right there. Number 6, that whole line. And then number 7, nothing but number 8, we're going to go with poisoning. Okay. Under B, codes from Y92, place of occurrence. Let's do that. And it says this last line. And also the 7th characters are used for Y92, also that line. C, the activity is going to come from this area. And it says the activity codes, which is this 3rd sentence, 3rd paragraph, I should say. All right. And do not assign, that whole line. And D, next to E, we're going to write secondary, or just do second, external cause codes. External cause codes, right by E. This secondary means these are secondary codes. They can never be primary codes. All right. And then by F, we're just going to write the numbers. Let's do this here. Under F, external codes. This is number 1. Number 2. Number 3. 4. Okay. And then right here, we're going to put after diagnosis code. After diagnosis codes. And this here, it says if two or more, let's highlight that whole paragraph right there. And we can do this, and we can do this here. Now, if you want to highlight these, you can. G, we're going to go with that whole paragraph under G. And it says for confirmed cases, abuse, all of that we want to highlight. H, it says code intent as accidental intent. And then all transport accident categories assume accidental intent. And then under I, 1, sequela are reported, and character S would be for sequela right underneath it. And let's make sure we highlight that 7 because we got to know that's a 7th character. Under number 2, current nature of injury code. Under number 3 is this whole paragraph. Use of sequela. So this whole paragraph, well, not the whole paragraph. Stop at follow-up care. Right here by follow-up care. Start at the beginning and stop at follow-up care. In J, number 1, you want to write first. You want to code the illness. And then second, you're going to code Y38. And third, you're going to code Y92.2. Okay. And then under number 2, Y38, and finish that all the way out. And then number 3, first is going to be the illness. Number 2 is going to be Y38.9. And number 3 is going to be Y28. Okay. All right. We are on to the next page. Y'all, we're on the last chapter. We're going to K. And for K, we're going to do this. And honestly, all of this under K, except for this here, all of this should be highlighted under K. Okay. All right, we in chapter 21. All right. Letters A, B, C. Okay, that's all we have. And then we're going to do our numbers. All right. In chapter 21, contact and exposure. Under here, we're just going to do category Z20. Number 2, categories code Z23. Against a disease on that third line. And then code Z23 and just complete the sentence. Number 3, first paragraph, and you're going to come down to 1, 2, 3, 4, 5 line. It says, because the status may affect. Finish that line off. Its outcome. Because the status may affect the course of treatment and its outcome. Highlight that. And then a status code should not be used with a diagnosis from one of the body system chapters. And then, for example, code Z94.1, and you just to that next line like that. Okay. And then over here, we're just going to put Z status. You can do this here, or you can put, because that's what all these codes are, Z status codes. We can do that. And we're also going to put for encounters weaning, okay, J96.1 right here, and then Z99.11. So we're going to have, let's just highlight a couple codes in here. Z21, Z68, these are some common ones, y'all. Z79. Let's go to the next page because they have some more. Z89, Z93 and 94. Just some common ones that we often see. And number 4, and 5, and 6. On number before the first 2 lines. And then we can just go ahead and just do that. And the rest of these codes. In number 5, screenings, we're going to stop at the word, oh no, just the first 2 lines. There we go. And then right here where it says a screening, we're going to stop at exam. So just highlight that sentence. All right. And then we're going to highlight that. Observation. That first line and that second up until circumstances. We're going to do Z38 live-born. Z05 encounter. After the Z38 code under number 6 for observation, page G31. And then code from subcategory Z03.7, and just highlight. I'm gonna stop at rule out. Okay. Okay. Let's go ahead and get some of this here under control. 7, 8, 9, 10, 11. All right. And then up here at the top, this last paragraph for encounters, and just do this whole entire paragraph. Okay. And we can do this here for those codes there. When we get to aftercare, we're under number 7, aftercare. Let's look for Z51.0. Okay. All right. So let's look for the aftercare. Let's look for Z51.0 under here. Do you guys see it? I don't see it. You know, they could have changed some of these diagnoses too. Let me make sure I'm on the right section. Oh yeah, I'm in the right section. Okay. I just wanted to make sure. Okay. So in this area here, the only thing we have to go by is this here. And then at the top, no, we're good. Let's go ahead and do this first paragraph though. And that's where I was actually at. I was looking at something else. So scratch the Z51.0. Okay. And okay, we good. We good for that section there. See, I got ahead of myself, y'all. That's what happens. All right, and we're under 8 for follow-up. And we're gonna go with that second line, second and third line. Okay. And then we're gonna go with this, number 9, the first line under number 9, and then 10, whole paragraph. And we're gonna go with that. And it says note right there, code 71.8 right there, and Z71.87 right there, and then Z7681 right there. So that's what you want to have highlighted. And in number 11 for encounters, we're going to highlight that guideline underneath there. And we're going to go with only, I'm sorry, not only, category 3, Z3A. That's our, and then also encounter for supervision Z34, those two. And then also, we want to highlight outcomes, this one line right there. Categories 000-008, elective termination of pregnancy. Let's turn to the next page. And at the top, it says we're also going to highlight the outcome of delivery, category Z37. That first line. And then codes in Z37 should. This here, that's what you want to code. And of course, we're going to do that. So let's go 12, 13, 14, 15. So number 12. So 12 we have routine administrative examinations. We can do this. And this first two lines. Okay. 13, miscellaneous Z codes. And we're going to do the first two lines under there. Prophylactic organ removal, go ahead and highlight that. And then where they have family history of cancer, the principal, let's go ahead right here. All right, and we're going to highlight all of that. Those first two lines. And where it says encounter for prophylactic surgery, let's go ahead and highlight that as well. That whole paragraph, you might as well go all the way to the end. Yep. And then right here, it says a Z 40.0 code, and code that and highlight that all the way up to the end. There you go. And now we have all of these miscellaneous codes that we could take and do this and that. And under 14, we have non-specific codes. Setting should be limited right here. In those two sentences right there, two lines. And of course, we have these codes here. And under 15, Z codes that may only be principal listed diagnoses. Let's highlight this entire paragraph. And we're going to do this here. But we also going to write first listed principal / first listed diagnosis DX. Okay. And our last page, last section, and we're going to finish that up here. All right. And for 16 and 17, And now 16. So this section here, the newborn and infants is just telling you to go to this guideline again. So we're going to go ahead and highlight this guideline. Okay. And then social determinants of health. These are the codes that would determine that. So we can highlight that. And then chapter 22, just for coding purposes, this is what we're going to do. These could be first. And we're going to do an arrow to here, arrow to there, an arrow to there. And then second would be the unrelated signs and symptoms. Let me pull it up so you can see. And I put an arrow to U0.7.0, U07.1, and U09.9. So these will be your primary diagnosis, and this is the second, unrelated signs and symptoms. And then in section 2, which is very, very, very important, okay, right here, H, uncertain diagnoses. You want to make sure that we have this here highlighted, okay? And this basically says, let's highlight all of it. Highlight H. If the diagnosis documented at the time of discharge is qualified as probable, suspected, likely, questionable, possible, or still to be ruled out, compatible with, consistent with, or other similar terms indicating uncertainty, code the condition as if it is existed or was established. So the key word in all of this here, which is all of these are keywords, but this is really the main thing about this here. Time of discharge, circle. Okay. And this will conclude our ICD-10, all 22 chapters of our guidelines of writing, highlighting, and underlining, circling, everything we did so that you are prepared for the test. So thank you for preparing your ICD-10 guidelines with us here at Inspired Code Consulting. And we thank you, and we have other videos that you can look at, especially for, I mentioned earlier, we have a burn video so that you know exactly how to code burns. But just look at our other videos. So thank you for joining, and happy coding.